Good morning, everyone. Welcome to our daily webinar. My name is Heather Kinzie, and I'm joining you from the Strive Group in Anchorage, Alaska. Again, welcome. Today's topic, hopefully, is an interesting one for you and a timely one for you. I'll be discussing returning to work during this COVID-19 pandemic. There's a lot of questions that we've been fielding, specifically from employees who have been asked to return to work. And so, like I said, I'm hopeful that this webinar is timely and valuable for those of you who need it. If you happen to be an employer in the webinar today, don't despair, don't hang up. I think there's probably going to be some good information that you can use as well. A little bit of housekeeping before I dive into the topic. You can join you can visit our website at thestrivegroup.com. That website is has a host of resources, but it'll also have our future programming. You'll see that Wednesday we have a specific Q&A just for employers that are reopening their work sites, and some information that you'll need to have behind your belt or in your noggin, so to speak, in order to make those workplaces safe for your employees to come back. Tomorrow will be Tech Tuesday. I'll be talking about optimum environments for remote work. If you're joining us live, on the right-hand side of the screen, you'll see a chat function, and that's where you will ask me questions or make observations. Marshall is moderating this webinar today, and he will gently interrupt me with those observations or questions, and I'm hopeful that I can get to them all by the 11 o'clock hour. If I do go a little long in order to answer those questions, I hope you'll forgive me. All right, but let's jump in. And again, this is a Q&A, so the content is all driven by frequently asked questions that we've been getting that I think are probably relevant to the majority of our audience. And the first one is, do I have to go? Our employer is opening back up. Do I have to return to work? And I got to tell you, the answer isn't as simple as just yes or no. There's a lot of things that have to be considered. So if you can't go back to work, or if you don't want to go back to work because of a COVID-19 related issue, either you're in self-quarantine, or you have symptoms, or you're caring for somebody, all of those reasons to not be at work that we've been discussing for 6 weeks now, all of those will sort of come into play before we can easily answer that question, do you have to return to work? So a lot of things that you'll want to consider is, do you have accrued leave? So, perhaps you've been furloughed for this whole time because the work didn't exist, but your leave banks got frozen in time, right? So you are furloughed to, for lack of a better phrase, release unemployment benefits. But now that you're called back to work, you might have access to those leave benefits that were frozen in time before you got furloughed. So things like annual leave or vacation leave or sick leave. If your employer is mandated by the FFCRA, and you may remember way back when my very first webinar was on the Families First Coronavirus Relief Act, which specifically put into play some paid leave provisions and emergency family medical leave provisions. So if you work for an employer who's mandated by the FFCRA, then you may have those types of leave benefits now available to you if you're unable to return to work. But then that begs the question, are you really unable to return to work, because of self-quarantine issues, or because you're sick, or because you're caring for someone who's sick, or, so on and so forth? Or are you just simply afraid to go back to work? And I get that, right? And I'm hopeful that your employer also gets that. This is a real fear that, that lots of people may have, regardless of whether or not they personally are susceptible to this virus or not. But what I would beg you to do is to consider why you are afraid of going back to work. Is it because of close contact with a bunch of strangers? Is it because your previous work environment had you in a cubby environment that you were, super close to each other? Is it because you sat across the desk from another colleague, right, with no barrier? these types of things can be mitigated. And employers, you have to trust that employers don't want to intentionally expose you as their workforce to unreasonable risk. And so if there are some mitigating activities or measures that can be put into place, or if there are some tightening of some internal controls that can be done in order to make your work safe, you have to trust that they will work towards doing that. And maybe it's something that they just haven't thought of, right? They hadn't considered that fear from their employee. And so when that employee reasonably and professionally brings that fear up, then perhaps compromises and some collaborative problem solving can happen to minimize or otherwise mitigate the risk. Okay. The next question that we're getting a lot is, does my boss have the right to ask me about my health? Now, for the most part, the answer is yes, but it needs to be COVID-related health issues. This is not the get out of jail free card to start asking people if they're, pregnant, or if they have a heart condition, or if they're, struggling with some other, ailment or disability, if you will, that is not otherwise obvious. But if your employer is asking about COVID-related health issues, such as, have you been exhibiting symptoms? Have you had a dry cough? Have you been running a fever? Can we take your temperature, right? These things 3 months ago would have seemed unreasonably intrusive, given the environment that Americans have often enjoyed about protecting their own health information. But now that we have a public health crisis, these things are, for lack of a better phrase, relieved a bit in order to protect the community, right? So I would anticipate your boss asking you COVID-related questions, and perhaps maybe not your boss, your direct supervisor, but maybe someone that has been in charge, whether it's someone in human resources or the safety person, or somebody else like a member of a task force specifically for these COVID-related issues. Okay, I think you should reasonably expect that. The next question is, does my boss have the right to deny me entrance into the workplace? And the answer is yes. In today's world, because we have a public health issue going on, then if you have a fever, or if you have exhibited symptoms, or if you've been exposed to somebody who has tested positive, and so on and so forth, your employer has the right to deny you entrance to work. And that is because the community at work, their health sort of overrides or trumps your freedom, if you will, to come and go to work as you please. Okay? So again, there's always caveats to that. It's not as simple as saying, oh, heck yes, or oh, heck no. You have to look at the totality of the circumstances. But overarchingly, if the community health, so either clients or the coworkers, if their risk of being exposed is great by allowing you the freedom to come and go as you please in the workplace, then you can assume that your employer is going to try to tighten that up a bit. Okay, so a question that has come in is, can my boss make me wear a mask? It's an interesting question. I'll probably address it again in a later slide, but the easy answer is yes. If the employer is providing PPE, personal protective equipment, because there is a health risk or a hygienic standard internal control that is trying to be enforced, then yes, the employer can make you wear a mask. And so if you choose not to use the PPE provided to you, there will probably be some other consequences associated with that. Right? So moving on specifically to safety, what are the requirements to open a business during this time? I got to tell you, I can't answer this. Every single community or state or city-run government or whatever, they're going to have slightly different requirements that businesses have to adhere to in the event they want to open back up to the public. So for instance, your city may have 25% capacity standards, for a restaurant or for a business that was otherwise open to the public. And so that would be requiring the employer to maintain that standard, to adhere to that city or that locality's government mandates. So I can't really answer that question, but I have a website there. And I know that website URL looks just unruly, but just bear with me here. That website is, think of it like a portal to all of the major communities around the country who are providing this information on their own websites. So think of it like this portal has done a little bit of your research for you. And so we have Hush Blackwell to thank for that, but they've got a site where you can just plug in your zip code or plug in your city, and then they will let you know those reopening mandates, provided your city is having that stuff on their website. So just so you know, as a resource, if you want to jot down that website, or if you just want me to send it to you, jot me an email and I'll send it to you after this webinar. So the next question is, what should I expect my boss to do to keep me and my colleagues safe? And that's like a really, really good question. We are dealing with that here in the Strive group. Our sister company, the Chariot group, has also dealt with this question. So we've got, I've got my insights on that. First and foremost is information sharing. I think that most employees are working for organizations who are trying to share information in an open and transparent way. Now, I know that there are some exceptions, and I'm sorry for those exceptions, but what I have found is that most employers are trying to be very transparent about what they know at this time, what they're trying to do at this time, and how they're planning on keeping the employees safe. But it doesn't mean that they're going to have all the answers the day you come back. It could very well be that they say, okay, we're opening up the office on Monday, May 18th, for a certain number of employees, and here's what we know at this time. And then we will address some other employees on May 20th, but only if we can figure out X, Y, and Z by the 20th, right? So that would be an example of some pretty transparent information sharing. But keep in mind, they can't read your mind, right? Your boss, your human resources person, the owner of your company cannot read your mind. If you need information, ask for it, right? Again, let's hope that the majority of employers are willing to share what they know and what they don't know, and when they plan on knowing it, so they can share it with you. So that's first thing. Second thing is, I think you can expect some stronger internal controls. And what I mean by that are rules and protocols that didn't exist prior to COVID. So for instance, maybe they are open, but the front door is still locked, right? Because they are trying to monitor or otherwise control incoming traffic. So maybe now, instead of an open storefront, it is invitation only, right? I think that's a pretty reasonable expectation. You could see lots of open doors. So what previously hallways were closed off by, either a slider or a door or something like that, or maybe key access was needed. I think you might see some more open doors to allow for travel to go in and out without touching doorknobs. You may see things like, even though we're all in the office together, we're still going to do video conferencing, and that's to stop the traffic in the hallways or stop the everybody crowding into our conference room for a meeting or something like that. So I think those are just some examples of internal controls, but I think you should expect those internal controls to be different when you return to work versus what they were when you left work a month ago or 2 weeks ago or 6 weeks ago. Okay. If you have an idea for internal controls, something to keep a work surface clean, or maybe some ideas on how to keep those work surfaces cleaned throughout the day, I would strongly encourage you to talk to your supervisor to see if those ideas couldn't mitigate some others' fears or mitigate some safety concerns. And see if you can't get them executed and implemented in your workforce. And again, most of them are just going to be temporary. I don't think that we're going to see the same internal controls today that we see 8 weeks from now, right? But I think some of them will probably still be around, right? Because it's not like the COVID-19 just decides to go away, right? But I do think you're going to see some flexibility and some fluctuation, and I think we need to prepare for it. So for those of you who like rules and who find comfort in structure, I think some resiliency is going to be your best friend right now to realize that we're in a very fluid situation. And then finally, PPE. And again, I kind of talked about it in the previous slide. I think you can expect and should expect your employer to provide PPE to you and to expect you to wear it. Now, whether or not this PPE is just masks, or if it is something more formalized or more fancy, if you will, like they could, could be gloves, it could be gowns, it could be, some other type of thing, not just the regular facial masks that you see people wearing out and about. But if your employer is telling you that you are in a high risk exposure area and that this is the PPE that is now expected, I think one, that you should appreciate that your employer is trying, and two, you should abide by that. Now is not the time to go rogue in the workplace. And even if you don't think it's safe, to not wear it, right? It's no different than any other PPE. If your employer gave you 6 months ago a waist or some type of a back support because you do a lot of lifting, your employer had every right 6 months ago to expect you to wear it to reduce your risk. The same thing goes for masks, safety goggles, gloves, gowns, and so on and so forth today. All right? So then these are some loaded questions. I was actually, to be honest, I was afraid to load some of these into the deck because they are so incredibly dependent upon the totality of the circumstance. But I'm hopeful that I can give you enough relevant information for you to either find some comfort in the answer or to maybe direct a different question to me after the webinar or before the 11 o'clock hour. So it's a lot of what ifs, right? What if I get sick? So first of all, if you get sick and let's say it's over a weekend, or let's say that you develop symptoms on a Tuesday night, I beg you to not show up to work the next day, right? This is the time to call your employer. Now, I know that you may have internal procedures or protocols, to calling in sick or to requesting leave. But I would beg you to let basic logic drive your decision making. This is not the time to show up to work and to ask your supervisor and other people while you're walking around the office, hey, what do you think about this cough? Does this sound, kind of flu-like or whatever silly, I know it's a stupid example that I just offered, but whatever thing that, symptoms that you're experiencing, it's not the time to go into the workforce and to demonstrate those symptoms or to talk about those symptoms in an open environment. That is the time for you to call your healthcare provider and ask your healthcare provider in a telehealth situation to guide you on what to do next, right? So first and foremost, I beg you not to go to work if you have symptoms or if you think that you are sick, because the risk of exposure of now you entering the workforce is high. So please don't. Second is it a workers' comp issue? We're getting that question a bit, and I got to tell you, I don't know the answer to it. Obviously, workers' comp is a complicated issue right now. So if we go to the basics, the very, very basics of workers' comp, you look to causation. It's called causation. So, did the injury or the illness arise out of and in the course of employment, right? So had it not been for me conducting this work activity, right, that's causation. Had it not been for me doing that, I wouldn't have been hurt. Had it not been for me doing that, I wouldn't have been exposed or I wouldn't have been ill, right? Second thing is you have to look at the protocols that were in place during the work taking place. So was there greater exposure or was there exposure to a greater degree than just the regular part of the work community doing that in general? So for instance, that would be, like if all of us were at work and we were all doing X, Y, and Z in the same manner, why is it that John got sick, right? Because everybody else was doing the exact same thing for X, Y, and Z. They did not get sick. So was it really the work that made John sick? right? So that's called, all of that is the totality or the causation of the matter. So I can't tell you if it's a workers' comp issue because I can't think of the 100 million reasons where it might be to combat the 100 million reasons where it might not be, right? But if you happen to get sick while at work, that's what will be looked at, right? It'll look to see if there is a causation that because of what happened at work, it raised your risk. Does that make sense? Hopefully it does. So do you get leave if you're sick? And this again goes to, does your employer have a sick leave policy? Do you have sick leave benefits available to you? Was your employer mandated by the FFCRA, the federal FFCRA? I'm going to lose that. So Families First Coronavirus Recovery Act, FFCRA. Is your employer mandated or required to follow that? Because if so, there are sick leave. There's a 2-week sick leave provision in that, paid at 100% of your salary, or there's an emergency family leave act, right? So that's actually only available if you're taking care of somebody. But if somebody else is ill or cannot go to childcare or a variety of those other issues, then the FFCRA may kick in. It is not at full pay. Or if you are unable to go to work because of a direct COVID-related thing, you're experiencing symptoms, you've been diagnosed positive with it, blah, 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 then the PUA, Pandemic Unemployment Assistance, may kick in. So you're not getting regular unemployment benefits, but there could be PUA benefits that are extended to you, right? Not necessarily under the sick leave option. That is a typical work-related situation, but otherwise. So then what if my coworkers get sick? So there's a whole bunch of things wrapped in or packed into that question. So let's just break it down. If your coworkers get sick, you can assume that your employer is going to separate that coworker from the workplace, right? So they'll be mandated to stay away. Very similar to the question on my very first slide, right? Can my employer deny me access? The answer is yes. So first and foremost, the sick employee or the sick colleague exits the workplace. But then what about us when we get, for those of us that remain? So a lot of things will happen at that point. So the reasonable employer, if someone gets sick and leaves the workplace, there'll be a little bit of investigation happening before they leave. So before I get asked to leave the workplace, my employer will probably ask me, who have you been in contact with? Who have you spent more than 20 or 30 minutes with in the last few days or since you've been back to work? During that time, were you wearing a mask? Were you utilizing your PPE? What they're trying to do by asking those types of questions is not to make you feel bad or not to otherwise place blame on you or shame you for not wearing a mask or whatever the case may be, but they're trying to identify what risk you had when dealing with others. Because, for instance, if they're asking me this and I had met for 2 hours with Marshall in my closed office space and we were talking about X, Y, or Z and we weren't wearing our masks, then my employer knows that they need to contact Marshall, because it could very well be that Marshall has an elevated risk and that Marshall also needs to be sent home, right? Especially if I end up testing positive, right? I'm not just experiencing symptoms that could be allergies or could be a regular flu, but now I've tested positive for COVID-19. And meanwhile, Marshall knows that he spent 2 hours with me yesterday in a closed office, right? So it is through the employer's due diligence that they're going to ask me questions before I leave the workstation or before I leave the workplace, so they can identify who I was in contact with, to perhaps identify whether or not they should also go home and stay at home in a self-isolated or a self-quarantine type scenario. Okay, so the question is does the business shut down if one employee gets sick or tests positive? And I can't answer that, right? So if it's likely that everybody has been exposed, then yes, perhaps that business shuts down again. But if it's only likely that one or two employees were exposed and now that is being mitigated, then maybe the business doesn't have to shut down again, right? I don't know the answer to that, nor do I want anybody to give you the answer to that today, because we don't know the circumstance that you are dealing with. We don't know the risk of exposing everybody else in the in the workplace until we know what we're dealing with. This is a movable target, and I would ask that everybody have a little bit of patience and exercise a bit of logical reasoning to understand that there is no cut and dry, right? So, but you can expect, as the employee, you can expect that questions will be asked, that those answers will be assessed to determine what happens to the workspace or the employer as a whole. Now, clearly, places will be cleaned, right? So I know that the CDC is recommending a higher level of sanitizing a workstation. And lately they've been recommending that we wait for the dust to settle. So sort of close off that area, but wait for those airborne things to settle before you go in and immediately start cleaning the area. But you have to trust that an employer is going to do what the CDC is suggesting that they do, or that their own safety protocols require to happen to someone's workspace who has tested positive. Okay, so I know that's a lot to unpack, and I don't know if I got to all of your answers specifically on what my coworker or what happens if my coworkers get sick. But there is another question that Marshall is giving me, so let me glance down at my phone here. I apologize for breaking eye contact. If I have allergy symptoms that are similar to COVID-19, am I required to get tested to get confirmation that it's not COVID-19 before returning to work? That's a good question, and the answer is it depends. If you know that you have seasonal allergies and you know what those symptoms are, watery eyes, sneezing, and sort of a cough to help clear the area, then I would assume that your employer will want to know that, right? Your employer will want to know that you suffer from seasonal allergies and that these symptoms that you're exhibiting right now are pretty typical, right? But if your employer wants you to get tested to be on the safe side and testing is available, then I think that in these times, your employer has every right to require you to get tested, and perhaps even has the right to ask you to stay home until those tests come back. But again, if we don't have widespread testing, then your employer is going to need to understand that there may not be an easy way for you to get tested. It could very well be that your physician tells you, hey, these are seasonal allergies. You have this, twice a year, every year. They last for about a couple of weeks while we have things, pollen and everything, to be in the system. Could very well be that all your employer would need is documentation from your medical professional that you are not being considered at high risk or likely to have COVID-19 at that time, right? So something from your primary care physician should be enough that your employer says, okay, great, welcome back. Here are our internal controls. Here is the PPE that we're making available to you, and we're so glad to see you. That's a probable situation for that particular question. All right. Let's see. I'm just going to glance down at my phone to see if Marshall has any other questions coming in. No. So I think I answered. There was a question that came in earlier about wearing a mask. Can your employer make you wear a mask? The answer is yes. The question just came in. Do I have to tell my boss if I've been exposed? And the answer is yes. And I know that we have lived in a world of my health issues are my problem, but not when we have a contagious virus going around. So my own personal confidentiality issues do not trump my employer's obligation to keep everybody else safe. And so again, the answer to that question, the question is, I have tested positive, or I have been exposed, closely exposed, been in direct contact with someone who has tested positive. Do I have to disclose that to the employer? And the answer is yes, you do. During these times, the public health's protection is more important than your semblance of privacy or confidentiality to your own medical issues. Now, that's not to say that you have to disclose every single medical issue known to man to your employer, because as I stated when we first started this is not a free card to learn about Heather Kinzie's health issues. But if it is a COVID-related health issue, that stuff is generally pretty public at this time. We've reached that point in our communities that public health mandates some confidentiality to be loosened. Okay, so I'm hopeful that answers the question. We've reached the 11 o'clock hour, and my phone is not ringing that Marshall has any more questions coming in from our public, so I'll go ahead and wrap up. I would urge you to visit our website, thestrivegroup.com, for a playback of this and previously recorded sessions, or to see what our future programming is. If you have an idea for an upcoming webinar, or if you have a specific question to myself or to any of our experts that have been guests on our webinars, feel free to submit those to info@thestrivegroup.com. I am happy that many companies are able to open their doors to get people back to work. I am a huge advocate on purpose-driven lives, and I know that when we're not able to work, or we're not able to add value to our communities or to our families, I know that affects our mental health. So I'm glad to see that some organizations are opening up. I will withhold any of my personal beliefs on whether or not it's too soon or just in time or any of that. Now is not the time for me to share that. But I do know that employers are opening, and I do know that they're trying, for the most part, most of them are trying very, very hard to make sure that we're all safe. And for that, I think we can be happy. And that's a reason for us to strive to be positive members of our new work community and to do our part into keeping everybody safe. So I thank you for giving me your time here today. I hope that you found it valuable. If you'd like to contact me directly, my information is right there on the slide. If you need the Strive Group for any of your future needs, whether it's as a business owner or a supervisor or an employee, I hope you think of us. And I guess there's nothing else to say. My script in my head has just worn off, so I will go ahead and log off. And I'll bid you all farewell, and I hope to see you again. All right.